All right. Well, thank you for joining us today. We're going to get started here in just a moment. I wanted to give a chance to let a few more people get on that I know had registered, so bear with me and we'll be right with you. All right. Well, thank you everyone for joining me today. I appreciate it. And I'm excited to share. This is our first Facebook Live webinar. For the last 7 months, we have been doing low dose naltrexone and CBD oil webinars live in person at local establishments to share some education like we do at the pharmacy on common topics that people have questions about. So today, because of obligation and COVID-19, this is going to be our first webinar. So I appreciate you joining me. If you have questions, post them up in the feed. I'll keep an eye on that. And I hope to be able to share with you some information that is very new, and but it's growing fast. And so it's something that's really exciting. And I hope that we'll be able to help you learn more for. So without any further ado, we're going to get going here. And there's a lot of information that we normally hand out at our seminars live in person. And because I can't do that today for you, I'm going to build a packet and send it to you digitally and or post it on our website. So I have this link set up here. It's medshoprx.com/FB Live for Facebook Live. And if you go there and register, it'll hit you up for an email. Don't worry. I'm not going to spam you or anything, but I'll let you know when I get the packet together. If we have providers that are joining us today, I have some documents that are prepared and some binders that I can send you to give you some more education physically, because it's a lot of information. So register there, and we can get you some additional information to back this up. This slide will show up again at the end of the seminar, so don't worry if you haven't been able to navigate to that page yet. All right, then. So without further ado, one of the things we believe in the pharmacy at the Medicine Center is power comes not from knowledge kept, but from knowledge shared. And Bill Gates shared this quote in his book, Business at the Speed of Thought, years ago. And I'm hoping that today this will be a good example of us trying to share knowledge that is not readily available so that we can help you learn more about some options that are out there. So my name is Brad White. I'm a pharmacist at the Medicine Center Pharmacy. I've been a pharmacist since 1996 when I graduated from Purdue University. And I feel like it's been an exciting journey. And this pandemic has been no different. So it's one of the things that we're actually going to talk about, a couple things in this program about some things you can do to boost your immune system and help you make sure that you're in the best position you can be. So a little bit about our company real quick. If you don't know, we have 4 retail community locations in Northeast Ohio, in Stark and Tuscarawas counties, in Canton, Louisville, Minerva, New Philadelphia. We have a staff of 12 pharmacists and 28 wonderful pharmacy technicians and delivery drivers and support personnel that help us take care of you every day. And so I'm a second-generation pharmacist. My father founded our company 44 years ago. And he did it out of frustration because he was tired of selling lottery tickets at the counter. He couldn't get to the pharmacy counter because he had to sell lottery tickets in the morning. So the goal with the Medicine Center has always been to take care of your health and to focus on healthcare related items. And we hope that we can meet needs that aren't normally met in the community pharmacy settings. So some of the reasons that we're doing this today is to share information, and some of it is really a directly related to patients that come in the pharmacy looking for solutions. We kind of have the luxury of being very accessible to patients. Um, and it's something that when you can't get to your doctor or you can't get to a healthcare provider, they come into the pharmacy or call us and they ask us questions. And we're happy to be of help. So that's some of today. The other thing is you can appreciate that our healthcare system is really stretched and a challenge. And I think that maybe as you've paid attention during this COVID-19 pandemic, it's been evident that we only have so much capacity. And unfortunately, there's roadblocks in place, not only for care, but sometimes to get care, whether it be health insurance regulations or prior authorizations or different healthcare politics, I like to call it, if you will. So sometimes these things get in the way of us being able to actually help people, and it can be really frustrating. And we know patients get frustrated too. So today we're going to share a couple things with you. One of the things that I have a couple takeaways for today, and my main takeaways are, especially with LDN, we're going to cover LDN first, and we're going to cover CBD a little bit later in the program. But I want you to keep in mind that most often, the more things you learn about LDN, the more you can be inspired and the more you can be frustrated. And I speak of this as both a provider and from feedback I get from patients. It's difficult to learn more about something that isn't in the mainstream, which brings me to two questions that I'm going to address and want to make sure that you understand today. And that's, why did you have to tune in on some pharmacist webinar today to learn about some products that maybe you haven't seen TV ads for or heard from your doctor? So we're going to answer those questions. And I think they're very important to know the reasons and the answers behind it, because it'll help you understand a little bit more about the healthcare system that we have in the US today. So moving on, we're going to talk today about basically a little bit of background, and then we'll get into the nitty gritty and give you some feedback here on what's going on with why we're talking about naltrexone today. If you have never heard of naltrexone before, it's actually an FDA-approved medication. It was approved in 1984. So it's been 36 years that it's been on the market. A lot of studies, a lot of safety profiles, a lot of data behind it. So there's newer drugs that have been reintroduced over the years, and new indications. So everything from alcoholism to different types of drug abuse to even obesity. In 2005, there's a product that LDN, that naltrexone can be used for obesity. So that's pretty interesting. And there's a new approval lately for autism. So for as far as the history of LDN, which is low-dose naltrexone, traditional naltrexone doses are between 50 and 200 milligrams. Low-dose naltrexone is just what it sounds like. It's a very low dose. It's like just about 1% of the normal dose. And this was something that was found truly by accident. It was truly trial and error by a brilliant man named Dr. Bernard Behari. He was a Harvard-trained physician who was working in addiction clinics and also working with chronic infectious disease patients. And I guess back at the time, given his level of skill and his hospital setup, he was working in both of these types of facilities. And he found that when he was treating patients for addiction with naltrexone, that they had an enormous increase in endorphins. And it got him to thinking. He was thinking, well, if I can get patients that get an endorphin boost from naltrexone, but sometimes with addiction patients, the dose was so high at 50 or 200 milligrams that they got a lot of side effects that were undesirable. And he wondered, well, maybe I can get an endorphin boost in patients with diseases like HIV or AIDS, who only have a 20% level of normal endorphin levels, and therefore their immune systems are very depressed, and they're depressed, and their systems are compromised. Maybe I can give these patients a boost. So he started experimenting with doses in these patients, and he discovered that a 1% of the normal dose, which was between 0.5 and 4.5 milligrams of naltrexone, gave his chronic disease patients a 300% increase in endorphin levels. He basically had a situation back in the late 80s where patients were having the best survival success rate in the country that had HIV. Patients that had 90 days to live were living for 3 and 4 years, and he had providers from all over the country asking him questions on how he did it and learning more about why it worked. And that was the exciting thing. His network of physicians and colleagues got together and started the research explosion that we are going to touch on today. So, way back in 2007, the first article was published by Penn State on Crohn's disease. And today it's literally been a fire hose of information. And I almost could compare it a little loosely to the information and the knowledge you've learned about listening to COVID-19 in this pandemic environment. We heard a little bit about it back in January, about there were some issues in China. And then now probably most of you are tuning in every day to hear the governor in the state of Ohio and learn about the state of affairs. So there's been an explosion of knowledge, an explosion of research, and a lot of very smart people trying really hard to help a lot of people that are affected by COVID-19. And just like this with LDN, there's a lot of people that are supporting research for finding treatment modalities for patients that have situations for chronic pain and autoimmune diseases that we're going to learn about here in just a minute, that it really makes a big difference for these patients. So how does LDN work? The interesting thing about LDN is it wasn't designed to be a drug to treat a certain disease. It wasn't designed to lower cholesterol. It wasn't designed to help with male erectile dysfunction. It basically was originally discovered to help with patients that had chronic alcoholism or addiction potential diseases. In digging into Dr. Bahari's method of using a very small dose to get a result in patients with a compromised immune system and chronic disease, Dr. Pradeep Chopra found that when he discovered and dug into this mechanism, that there's really a couple different basic takeaways as to why this works. And one of the reasons it works is it raises endorphins and modulates the immune system. And this is interesting because when we talk about CBD in a little bit, it does a very similar thing. CBD also helps reduce inflammation and helps with the impact of pain and inflammation, but via a different mechanism. So we'll talk about that a little later, but they work together very well. So why is LDN good at so many things? Well, it regulates the immune system into indirectly controlling systemic inflammation as well as neuroinflammation, as well as cellular proliferation. So, one of the articles that I give to my patients that come to our live seminars, and I'll include it for you all, is an article from AARP that was done a couple months ago about chronic inflammation being the root of all disease. So there's a lot of theories now about inflammation being an underlying cause to a number of diseases. And that makes a lot of sense when we talk about autoimmune diseases, because that's literally the body's immune system attacking and causing inflammation throughout the body. LDN also has an ability to increase the production of endogenous opioids. And that's a fancy way of saying it boosts endorphins. If you need an analogy for what do endorphins do, endorphins is that, if you want to think about that surge of energy that you get when you have you're driving down the road and somebody pulls out in front of you. Oh my gosh, your blood pressure goes through the roof. You get really anxious. You're angry. That rush is a good example of endorphins and how our body uses that cortisol release to help deal with a stress stimulus. So that's something that LDN does well. It also blocks the release of pro-inflammatory cytokines like interleukin-6 and interleukin-12. And these inflammatory cytokines are what cause inflammation. So, in Ohio, even though the weather's a little strange today, we're starting to get to the point where the trees are starting to flower or bud or bloom, and you got some flowers blooming, you got the pollen kicking up. If you get seasonal allergies, you're witnessing inflammatory cytokines that are causing runny nose, itchy eyes, and things of that nature. So these are all things that that LDN can help modulate. So the ways it works, we help decrease inflammation, we modulate the immune system, and LDN is really a disease-modifying agent because it has these qualities. Now, I'm going to show you guys a number of different research studies, and I'm going to provide it in the packet I give to you. I don't want you to be intimidated by all these big words and all this reading. So I guess what I'm just trying to show you is everything I'm going to touch on today, there's a lot of data to back it up. So this isn't something that I just feel passionate about. It's something that I can back up in paper and research by respectable organizations. Um, so, one of the things we talked about in the previous slide was LDN inhibits production of IL-6 and TNF. The interesting thing about that is one of the things they're using right now to treat COVID-19 are IL-6 inhibitors. So we can talk about that a little bit later, but I can't promise you that there's a potential that LDN could be a modality to treat COVID-19, but it has some properties of different medications that are being used right now in experimental studies to treat patients that have COVID-19. But it's the inflammatory response that LDN works really well at. And this is a study out of St. George's University of London that highlights that. Here's another one out of Switzerland talking about inflammasomes. If you want to impress your loved ones tonight over dinner, you can talk about inflammasomes and how they increase infection or stress that trigger, again, inflammatory cytokines that cause these problems in our body. So a lot of different type of receptors or transmitters that cause inflammation or responses in the body are triggered by these events that cause inflammation. There's just a number of different things here that we can talk about that all relate back to inflammation. An interesting study from University of Massachusetts, again, talking about blocking some of these key inflammatory processes and people getting improvement in their disease states like Alzheimer's, a terrible condition. So if we can look at trying to switch off inflammation, if you will, there's a high probability that we could find products or medications that could treat a wide variety of conditions that have an underlying inflammatory basis. And that's something that LDN appears to be very good at. And we're going to talk about more about this in a second. But I wanted to share a little bit real quick with my experience with LDN as a pharmacist. And one of the most rewarding things that I have the luxury of doing, especially during this time of COVID-19, is to share with pharmacists all over the country that are implementing new practices to both keep their patients safe, keep their staff safe, to help serving the community, and also sharing information about best practices. And one of the most amazing things has been the ability for the LDN conference to be in existence. The LDN Research Trust organizes this. It's been around for years. There is an enormous amount of information that's been shared by providers all over the world. The next one's going to be next year in Pennsylvania, and it proves to be very interesting. And hopefully, with the whole thing going on right now, it will still be able to have a way to share new information and research on how LDN could be a possible benefit for patients. But I learned about LDN through an organization that we work with for our compounding pharmacy. Their name is PCCA, and I had the luxury of learning from pharmacists up in Wisconsin and a researcher from Yale who actually helped us learn more about LDN through these scientific pathways. And so what we have going on now is we have the ability to work together across the country to provide a network of learning and education and resources for pharmacists and patients to help spread this word. One of the most challenging things in our environment is when you don't get the chance to share information through the official drug company process. It's very difficult to get to the end patient. And one of the reasons that you're tuning in today and you have to learn all this from me is because this drug's been on the market for almost 40 years. No drug company can patent it and make money off it again. It's out in the marketplace. It's available generically. They can't spend hundreds of millions of dollars on a research study and repatent a drug and be able to sell it again and make money off of it. So that's why there hasn't been a drug rep that's gone into your doctor and told them about what this is. The other reason is unfortunately, I didn't learn about this in pharmacy school. I've been out of pharmacy school for 25 years. But, our providers, our doctors, our nurse practitioners, unless they've had the luxury of studying at U of M at Madison, or Mayo Clinic, or maybe even Cleveland Clinic, or a couple other places around the country, they're not learning about this because it's just the research is so new, it hasn't been widespread and available. So that's one of our goals. And this is a result of a group of pharmacists that we work with got together, and once they had 1,000 patients using LDN, they basically gave them a self-survey. And the self-survey was, tell me what you're taking and what your results have been and what your side effects have been. It was very simple. It was, basically all feedback from patients. The dosage protocols here, I'll note, were very simple at the time. This slide shows that we had dosages basically of 0.5 milligram, 4.5 milligram, 1.5 milligram. We basically had a situation where 3 dosage strengths were the main strengths. Now we have over 24 dosage strengths that we work with. So a lot has happened since this study came out. But the interesting thing that I want to point out is that, the majority of the patients reported no side effects. 87% felt it was very well tolerated. 12% had some insomnia, which is, difficulty sleeping. 9% had vivid dreams. So this drug is very safe. It's also very affordable. So it's not one of these medications. You do need a prescription, but it's not a medication that you have to spend a bunch of money on to get a result. You have the luxury of using your provider that you work with now, and you could utilize a compounding pharmacy like ours that's accredited, and we can help you provide a customized dosage form that would be tailored to your particular condition and disease state with the help of your doctor. So as we looked at the information from these patients, they all also were asked to fill out what type of condition their doctor was treating them for. So the neat thing is these patients listed all of these 48 conditions. We expected to see fibromyalgia. That first research article I showed you was Crohn's. We expected to see simple things like that. Never in our wildest dreams did we expect to see things like brain fog or weight loss or restless leg syndrome. So the interesting thing about that is if you look at this screen, almost all of these conditions have that inflammatory marker background. So it's interesting to look at how just because LDN can help modulate the immune system and reduce inflammation, you have the potential to help a lot of patients with a lot of different disease states. So overall, patients self-reported that they had 84% success rate. And that was back when we only had these basic dosage forms and dosage protocols. And now we've gotten a lot more sophisticated because we've worked with providers and patients, and we've gotten really sophisticated at help meeting a particular need based on a disease state. All these patients had tried traditional therapies. One of the questions I like to ask live, and you're certainly welcome to post these up on your questions, is how many doctors have you been to? How many medications have you tried? Patients are telling us that they've been to 4 and 5 doctors. They've tried 5 and 6, maybe 10 medications, and they're miserable still. They're desperate for a solution. So this has been something that in this patient population has really been a savior for them. So I've got a couple slides here that also have some feedback. We had some before and afters, if you will. And I'm not going to read these to you, but I'll highlight the one here at the bottom. So, the patient lived in chronic pain on a daily basis. They couldn't go to work anymore. They were fatigued. They'd come home, pass out on the couch. They tried other medications that didn't reduce the pain. They didn't work. They were on 900 milligrams of gabapentin 3 times a day. If anybody knows what gabapentin is, that is a hefty dose, and that's pretty tough on your stomach. So this patient had psoriasis. It was awful. Her hand was a mess. It makes you hurt to look at it. And I have a picture I'm going to show you here shortly about what her before and after was when she used LDN. But unfortunately, she lost her job as a result. So this is something that not only, all these conditions, it's easy to put a label up on the screen and say, I have psoriasis or I have rheumatoid arthritis, but really the patient's life is changed by these conditions. And like this patient here said, after getting success, she feels normal again. She wants her life back, or she has her life back. I mean, that's a powerful statement to be able to make. And it's a rewarding one to know that you've been a part of it as a healthcare provider. So, one of the things that we try to do at the pharmacy is we try to work as a team with your provider. And really, we call it the triad. We call it the physician, patient, pharmacist triad. We work all three of us together to find the best outcome possible. But really, we're now at the point where, with the luxury of adding our expert researcher, David Yazel, into the picture, we really have the patient kind of in the middle, and we have the physician, pharmacist, and researcher to help us maximize the outcome of our information and share it as well and effectively as we can. And that's been really exciting for me to be a part of, and it's really helped me learn a lot and share a lot with patients. We try to provide some educational materials, and you'll get one of these in the packet I'm going to prepare for you. But this is a 4-page document that's really a nice frequently asked questions, if you will, about low-dose naltrexone, how it works, what applications it has. I have a physician in town here that's nice enough to put these in his waiting room in his practice, and when he talks to a patient about LDN, he gives him one of these because he said, if I'm lucky, I get 12 or 14 minutes with the patient. It's probably going to take me 15 or 20 minutes to talk to a patient about LDN alone, let alone do the rest of their history. So he can give them a document like this, help them get some education, and then he can send them to our pharmacy, and they can either participate in a program like this or do one, or we can have a one-on-one and discuss it. So it's exciting in that regard to be an asset to the providers who are, especially in this environment, having very difficult time seeing patients and meeting their needs. We also try to provide guidance on how to order naltrexone. Now, this is one of our basic medication order templates. There's a lot of different dosing protocols. As you can see here, we have a standard dosing protocol for autoimmune disease like chronic pain or fibromyalgia or dermatology. But we also have situations where we have specialized dosage titrations and schedules for thyroid disorders like Hashimoto's or anxiety or depression. There's even some custom orders with very, very small doses of naltrexone for patients trying to get off opioids or to try to do weight loss. So this is just a sample, but we try to help make it easy for the patient or the provider in this digital world on where do I start? And we try to give them some guidance. So because we know, based on what you see on the screen right now, we know these protocols work because we've had patients that have tested it and helped us refine it. Other education opportunities. The LDN Research Trust has an excellent book. It's called the LDN book. There is supposed to be a new version coming out later this fall. It's edited by Linda Elsegood, and she was the founder of the LDN Research Trust, and we're going to touch on her in a little bit. But this book's pretty slick. It's got a number of chapters in it. It's an easy read. It gives you the opportunity to look at a bunch of different conditions, from multiple sclerosis and lupus to inflammatory bowel disease, chronic fatigue, thyroid disorders, depression, autism. It gives you a history of LDN. It also has a chapter on how to talk to your doctor about LDN. So if you're intimidated on trying to bring up a subject to your provider, I'm hoping that what I talk about here today will give you a little bit of confidence, but I'm gonna provide you with some information that will give you some really good science and research to give to your provider that can help you talk on the same level, and we can always be an asset at the Medicine Center also. We got a lot of new uses that are available for LDN. I'm going to show you some screens here in a minute that are ridiculous with the number of things that they have, but I will tell you that most on the up and up right now are dermatology uses like psoriasis or Hailey-Hailey disease. Mental health, this COVID-19 situation is a real concern for people being in the right place and having having a happy existence. Before last fall, I know there were studies going on with LDN, with the military and the NFL with respect to everything from PTSD to chronic brain injuries. I have a feeling that we're going to see a lot more use for LDN for mental health situations, given what's going on right now. Everybody's heard about the opioid crisis. LDN can be an asset not only to decrease inflammation, but also to help with pain control. And that's something that's a little bit beyond our discussion today. But if you have an interest in that, I'd be happy to talk with you offline, or maybe we can do a separate seminar with this on those subjects. But it's exciting and it's really fascinating. But it starts with education. um, Integrative medicine, functional medicine, metabolic code. There's a lot of things. Metabolic code kind of refers to pre-diabetes and situations with different metabolism malfunctions. And again, inflammation is an underlying cause. So our goal as the pharmacy is to help work with you and the provider to find the dosing protocol that matches your underlying condition. I can tell you that if your provider picks the normal dosage protocol from 20 years ago and starts you off with a certain dose and does the 3-dose titration, you have a 50% chance of being successful. But our most successful patients, up to 85% that report results, end up making between 3 and 5 different dosage changes. That sounds laborious. That sounds like a lot, I'm sure. But keep in mind, if you're able to dial in that dose to the specific dose your body needs, you're going to get more benefit from it, and you're going to feel better and be happier about it. And once you get it dialed in, it's usually a consistent dose that doesn't change for a long time. So that's pretty exciting. Hybrid dosing is something new. It's something that there's a Harvard article I'm going to flash up here in a little bit that shows you some information about that. But hybrid dosing is a fancy way of us talking about how you give a divided dose. Traditionally, LDN dosing was always done in the evening, but we're finding if you do a divided dose, like maybe in the morning and one in the evening, that you can get some extra advantages both for that mental health aspect, but also for an underlying condition like fibromyalgia. So I'm going to show you a lot of conditions here, and I'm not going to spend a lot of time on it, but I just want to show you that everything on the next couple slides you're going to see. I have a research article. I have a PowerPoint from a provider who is an authority in the subject, or I have a case study that we can share with you and or your provider to show that there is results in these conditions. Some of these conditions are pretty exotic, but overall, they all have an underlying theme of inflammation or autoimmune condition. So the ones you see in red, like psoriasis or Addison's or Haley on this screen, we all have pharmacists that have patients that have had these conditions and have had feedback on how they've progressed and done well and had improvement with LDN therapy. Hashimoto's thyroiditis, Crohn's, celiac. It's fascinating to look at these lists and think, is this really too good to be true? Lyme disease. Lyme disease is a very, very difficult to treat condition. Infectious disease doctors are doing studies with LDN right now and finding promise. So, sometimes necessity is the mother of invention, and there aren't a lot of great treatments for Lyme disease, and LDN is proving very promising. There's also some studies in here that I'll flash up that have some background in treating cancer and cancer situations. Very interesting articles that have imaging studies to back them up for proof. So those are very exciting for things on the horizon. Parkinson's, restless leg. You don't need to take necessarily a medication you see on TV advertised that's really expensive for restless leg. There are other ways to attack that, and we can talk about that. We talked about anxiety and some psychological conditions earlier, but all these different conditions, it's really fascinating how exciting and the opportunities that there could be for patients who are struggling for a solution. All right. So going to touch on some of the articles I've got for you to keep moving along here. Basically, each one of these studies has some takeaways. So I mentioned in the very beginning the Crohn's article from Penn State. The exciting thing is the results. So this test was very simple. The patients only got one dose. We don't recommend that you start at this level at this point in time. We recommend a titration. But even so, 89% of the people responded, with 67% of the people achieving disease remission. And it was a very basic dosing schedule. With a hyper-targeted dosing schedule based on your particular situation, it's possible that you could see results over 80-85%, like we talked about earlier in the program. Fibromyalgia, another condition that a lot of people are suffering from, very difficult to treat. Often patients are on multiple medications, and it's difficult to feel normal and to get about your daily living. So this was a 12-week study with, again, just one simple flat dose of 4.5 milligrams over 12 weeks. Patients reported a 30% drop in pain. I guess I wish it was more, but basically, I feel like if we can dial in and get that specific dosing protocol to meet your need, it can be much more significant possibly. But 30% is nothing to shake a stick at. That's impressive. CRPS, or chronic complex regional pain syndrome, is one of the most painful conditions known to man. The analogy I like to give patients in our seminars is if you can think about the t-shirt you're wearing right now, and generally patients that have CRPS, they cannot even tolerate fabric touching their skin because it is that painful. Your nerves are constantly firing, sending pain signals to the brain, and it's very difficult to get under control. And it's something that LDN has shown great promise. And this study actually was done by Dr. Chopra, who discovered the mechanism that I highlighted in the beginning of the program. So he is an authority in this particular area, and a lot of patients now are being tried on LDN for this purpose. So, most of you here are patients. We've got some providers on here too, I see now. But, we do provide education for providers on a higher level. One of the things I like to show everybody is this is my nurse friend patient who lost her job because she had psoriasis so bad she couldn't bend her thumb and finger. She couldn't type anymore. She couldn't hold her pencil anymore, and she was a secretary. She had talked to her dermatologist. She'd been to Mayo Clinic. She'd tried all the standard therapies, all the hugely expensive creams. She was really frustrated. She was miserable. Her family was miserable. She was a single mother trying to support them. So she talked to her doctor about using LDN because she'd heard about it on a message board or seen it on the internet somewhere, and they weren't real excited about trying it because they frankly hadn't heard of it and didn't know anything about it. So she ended up getting lucky and finding another provider who was willing to write it for her because he'd seen all she tried, saw she was miserable, knew that the side effect profile for naltrexone was very tolerable, and at the lower doses figured, what do you got to lose? So here's what happened. 8 weeks, after LDN therapy, her hand was nearly clear. The interesting thing and the frustrating thing is she went back to her dermatologist and said, look, this is what the therapy did for me, and you didn't want me to try it. You need to learn about this so that you can help other patients. And this isn't, I don't highlight this to scold any provider because they're all extremely busy. They're highly regulated. They're learning everything they can to help their patient. I don't know any provider that doesn't want to help their patient to be well and be better. But sometimes this info is just hard to come by, and sometimes it seems too good to be true. I promise you, there are so many studies, so much research, so much data that you can have confidence that LDN can at least be tried with or in lieu of other standard of care protocols. And this lady, I think, is a really good example for that. I mentioned earlier about mental health, and this is the study out of Harvard that talked about patients getting a scale and dealing with major depressive disorder. Major depressive disorder is very difficult to treat, and they found that LDN could have a 50% reduction in one of the depression scale scores for patients that took it twice a day. And it was just a 1 milligram dose. So I think it's something that's very cost effective and very safe that could be a real asset to people who are really in a bad place and need support. So touching on the speed of change, I alluded to the COVID-19 situation in the beginning of our program. In 2015, there were 262 PubMed articles on LDN. PubMed's like the Google for research articles, if you will. Today, there's over 1,200. I mean, that's a lot of growth in just 5 years. We started with 3 dosage forms. Now we're at 24 different dosages to dial in and customize it for patients' disease states. I'm excited for patients to see the possibility of having another option, but we have to work together. You just can't get a prescription from your doctor and assume that the dose is right from the get-go. We may need to help you play with it. So you got to give it a little bit of time and be a little patient, because sometimes it can be a challenge. So, I'm trying to do these educational seminars once a month. This is my first digital one. I hope that it's going okay for you. And if you have questions, please post them up in the feed. I see a couple of you have commented so far. I feel that this is a subject that makes being a pharmacist worthwhile. There's so much going on in our healthcare system that's frustrating, but it's exciting to have somebody come to us and feel like we help them. One of my favorite stories is we have a patient in our store in New Philadelphia who has Hashimoto's, and she shared her story with us in October at our seminar, and she's actually been interviewed by the LDN Research Trust. I failed to mention they have a podcast. They have a great website. It's ldnresearchtrust.org. I will put that in the packet that I prepare for you all that are listening today. But she shared her story there that she's a healthcare worker. She's one of those people that works at an insurance company and is responsible for reviewing all of the prior authorization situations and stuff to satisfy documentation for payment for claims for patients. She said she'd drag herself to work. She'd go home at the end of the day, collapse on the sofa. And at the time, her husband was deployed because he's in the military. And she didn't have the energy to cook food for her kids and to provide for her family in a way that they knew they needed her care at home, because it was all she could do to go to work. She's been on LDN for a couple years now. And interestingly enough, she was able to find a provider who has been willing to look at other treatment options for their patients. The particular provider is an OBGYN by trade, but he's invested himself in learning about other treatment modalities, not only in nutrition and CBD, but also in things like LDN. And it's been exciting to see providers who are able to take control of their practice and look for new solutions for patients. So if it wasn't for that particular provider, she may never have found LDN. And now she's a completely different person. And it's really exciting to hear how optimistic, and to know that, every day when you go through that grind in your workplace, you don't always get to hear these cool stories. And that's what really makes it, being a pharmacist, rewarding for me. So I'm going to switch over here to CBD, and we're going to run through this. CBD is something that is really interesting. It's been a source of frustration in the state of Ohio, and I think across the country. And I want to tell you, before you tune out and make any assumptions about CD, you hang in there with me and learn about what I have in the next couple slides here, because I think it'll change your mindset and it'll help you understand what CBD is and what CBD isn't. Okay. So first of all, what CBD is. CBD stands for cannabidiol. It comes from the hemp plant. It doesn't have any abuse potential. It is not psychoactive. So what that means is if you take CBD, you are not going to get high like you do if you smoke a joint for marijuana, okay? While they are related plants, they are cultivated for different purposes, and as a result, they have different properties. So think about coffee. Some coffee brews are, bolder than others. Some have different flavors than others. So what you got to keep in mind is that, CBD is cultivated for a high cannabidiol content, Marijuana is cultivated for a high THC content, and THC is the psychoactive property. So it's one of those things that they both come from a hemp plant. They're cultivated a little differently. And, CBD really is just one of hundreds of different cannabidiol profiles. And we're going to talk about those here in a moment, but you can't get high from it. The World Health Organization, which we've all heard a lot about in this COVID-19 situation, says that in humans, CBD exhibits no effects indicative of any abuse or dependence potential. So I just want to clear that up because every day I have people from patients to healthcare workers that still believe that CBD is marijuana. And I have to admit that I was guilty of that in the beginning too, because I was kind of frustrated with how marijuana ended up being sold in the state of Ohio. Given that it's a medical treatment, I really feel that that particular medication belongs in a pharmacy, not in some building down the street where people who aren't pharmacists dispense it. I'm not sure I understand that still, but that's another topic for another day. So how does CBD work? I want to give you the analogy of a lock and a key. So CBD, or an endocannabinoid as it's termed, it basically has a shape or a type of lock that opens a receptor key. And one of those things that happens, you might all have keys at home that open locks that you're not sure why they do, but maybe the key's worn down enough that the teeth aren't exactly still sharp and they're really dull. And so that gives you a little bit of jiggle room to open that lock. Well, the interesting thing about CBD is it opens a lot of locks that it's not necessarily a direct key for. And that's something that the endocannabinoid system is very, at least for me as a pharmacist, is very new. We didn't learn about this in college. Your doctor probably didn't learn about this in college. So we're all kind of playing catch up here. Research has been done for the last 20 or 30 years, mostly on marijuana and THC and how it affects the body. But we have endocannabinoid or CBD receptors in all these different body systems. Digestive system, endocrine system, cardiovascular system. You all know about the nervous system. Just think about it as a nervous system for the endocannabinoids or for the CBD products. And basically, when CBD is utilized, it has the ability to affect receptors and open locks and have results in all these different areas in the body. So it's pretty slick. This is the kind of a scary slide, so I don't want to intimidate you, but I wanted to just give you the picture that the endocannabinoid system consists of transmitters and receptors and enzymes, but it's really just like any other neurotransmitter system. And one of the things that we're going to talk about is the receptors CB1 and CB2. These particular receptors are receptors that have a particular effect in the body. And it's interesting because they're in different places. So if you look at the green CB1 picture dots, they're localized in certain areas of the body, and the blue CBD receptors are localized in others. But they cover the whole body in particular. So the cannabinoids bind to these molecules, and they either activate or inhibit a receptor that's in the body. And as a result of that, you have some outcome. Generally, the outcome is it can decrease inflammation and it can decrease pain conductivity. But there's over 100 different active phytocannabinoids that are found in CBD products. And as a result, they all act on different receptors in a slightly different way. So before we talk about the different cannabinoid profiles, I want to touch on the different types of CBD because there's more than one. So there's a full spectrum type. And if you're one who is enamored by the use of essential oils and you really like the effects that they can help you with your health, you're probably using a full spectrum essential oil that has the entire essence of that particular plant that it comes from. And that analogy works in CBD. Full spectrum undergoes the least processing. It offers the full benefits of the plant. It may have strong flavors or odors, and that is from the essence of that plant. To be legal for sale in the state of Ohio and most states in the USA, it has to contain less than 0.3% THC. THC is tetrahydrocannabinol. It is the psychoactive property. So even your full spectrum CBD has a touch of THC in it. It's not enough to get you high. I will warn you, there is a chance if you take enough full spectrum CBD long enough in a high enough dose, there is a chance you could test positive on a drug test if you're screened at work or at your job. So we'll more on that here in a moment. The isolate, an isolate is basically one fraction. I like to use the multivitamin analogy here. A multivitamin has vitamins A, B, C, D, zinc, minerals, magnesiums, a bunch of other stuff in it. A multivitamin might have 26 different items in it. An isolate example from a multivitamin would be vitamin C. So an isolate of CBD would just be that one profile. And while CBD may be something that might work for you in your particular situation, you need to realize that that's something that it's not going to be a situation where maybe you get the full benefit of the whole plant's essence. There might be more benefits from the entire extraction, and that's why we recommend the full spectrum product at the Medicine Center. Broad spectrum is the answer if you're a healthcare worker or a police officer or a fireman or one of those awesome first responders that are doing everything they can to help people right now in this COVID situation. You can use CBD to help you, and it has 0 THC in it. It basically has the broad spectrum of CBD profiles, but it just removes that THC essence. So, there's reasons that you can use all three of these. I will tell you, full spectrum is the most expensive. Isolate's the cheapest. It's probably what you're seeing at the gas stations. And broad spectrum is kind of in the middle, but it doesn't have that THC, and it's safe to use for our first responders and people that are concerned about drug tests. So here's a screen of the CBD profile. And this is interesting. This is not all of it, but these are the big ones. So you have CBD, which we've been using the whole program that we've been talking about. And, the CBD mechanism of action is broad because you look at CBDA and CBG and CBGA and so on. All these different components make up a full spectrum product. If we're talking about the isolate, we're only talking about CBD. We're only talking about CBG. We're not talking about this whole wheel of properties, if you will. So, the CBD mechanism we think right now, it sounds technical in the respect that it activates the TRPV1, which modulates body temperature. It modulates the perception of pain and inflammation. It activates adenosine receptors, promoting anti-anxiety and dopamine or glutamate releases. It inhibits fatty acid amide hydrolase, and it does a number of different things to help reduce peripheral pain and inflammation. So that's kind of the technical who, what, why, and how. But it's important to realize that we're learning still about CBD and some of the things that it does in our bodies. But it really seems to have a lot of uses, and we're going to talk about that here next. But before we do that, I want to touch on the essence, if you will, of CBD products. And if you've ever cut into a lemon, you know a little bit about terpenes. That little bit of lemon zest, that oil or that spritz in the air when you squeeze a lemon rind, that makes up the character of a lemon. And all these different terpenes on this screen make up different qualities in your CBD product. And it's really important to make sure that you understand where your CBD is grown and where it comes from. Now more than ever, we are all concerned about the number of products that are sourced from overseas in our country because we have shortages of personal protective equipment. We have potential shortages of different medications that come from India and China and other countries. Well, the good thing is some of the best CBD is grown in the good old US of A. And one of the brands that we recommend the most is Imbu Botanicals. It's grown at elevation in Colorado. It's grown in a high UV content in organic soil. They test it for everything from heavy metals to pollutants to, they use non-GMO seeds and products. It's important to know where your product comes from. And that's something that a lot of times we're not really sure where some of our stuff comes from in the US anymore. And I think that's a really good lesson for CBD right now. So, potential uses for CBD. What we're seeing in the pharmacy, I'm not making any claims. This comes from the Brightfield study that was done in 2017. But the most common requests I see in the pharmacy are depression, anxiety, and insomnia. There are patients that are interested in arthritis and inflammation. So, all these things work together based on the mechanism of action. And interestingly enough, all these things are also indications that LDN can be used for. So, they really complement each other in a nice way and they can be used together. CBD is nice because it's non prescription, it's more accessible. So if you're looking for something to give you a solution for one of these areas, don't be afraid to consult with one of my pharmacists at the medicine center, and we can help you with a dosage protocol and a solution to maybe meet your need, and we can go from there. We're going to talk here about some more effects of CBD. This Brightfield study is interesting because this was done and released when the U.S. was really getting hyped up about marijuana and CBD products. And it's interesting because people have always, in my opinion, had a perception that a natural product might be a better solution or a solution they're more willing to try when it comes to helping them treat a medical condition. And a large majority of these patients that tried CBD felt they had confidence in the result, felt they had confidence in the outcome, and felt that it either worked as well or better than their prescription medication. So I'm not suggesting you not take your prescription. I'm not suggesting you stop your prescription. I'm suggesting if you're interested in learning more about CBD, you make sure you consult with us so that we can do it in a safe and effective manner. And to speak to that especially, I'm sure that this nice lady working the register at a local retailer or gas station or convenience store is kind-hearted and doing what she can to take care of you. But does she know what medications you're taking? Does she know the drug interactions? Does she know what might happen if your liver is compromised? I believe in my heart of hearts that CBD belongs in a pharmacy because we have the pharmacological knowledge to help you understand both what you're trying to treat, what you're currently taking, and how a product like CBD or a natural product for that matter might interact with it. So that's something that the strength of a pharmacist or a physician or a provider education can really be an asset for. And that's something I just want you to think about. You drive up and down the street here in Ohio and you see signs screwed to billboards about come get CBD for me for free. That's great, but you need to know your product, know where it's coming from, and you need to understand what you're putting in your body because a little bit is great, but not a lot is good always. So what goes into a quality product? There's a number of different methods for extraction and preparation. There are carbon dioxide extractions, there's ethanol extractions, there's cold pressed extractions. Generally, the highest quality products out there on the market are third party lab tested, or they should be. They all have to meet that requirement of THC with respect to less than 0.3% to be legal for sale in the state of Ohio, especially. You don't want heavy metals or pesticides in your plant because once they're in there, they're very difficult to separate. And the most impressive thing, in my opinion, is the best quality products, especially like the Imbue Botanicals that we carry at the Medicine Center. They have a QR code on the box. And if you don't know what a QR code is, it's that square barcode that looks kind of like it's got little spots all over it. The cool thing is you can take your iPhone or Android and scan that barcode, and it will tell you where the product was grown, where it was packaged, the testing that was done, and what the results were. You basically have a whole bio on the CBD product, where it came from, and what is in it. And I think that's really impressive because we've been very slow in this country to do that, even with prescription items. It's not as accessible to you, the end user, as it is on the quality CBD products. So again, I'm going to recommend, USA sourced, Colorado grown at high altitudes with higher UV light for better concentrations of cannabidiol. One of the things to note that's interesting is everybody's probably familiar with the Chernobyl accident. And one of the things they did at Chernobyl, they planted hemp plants because they are kind of like the plant that absorbs everything in the atmosphere and the soil. They're kind of like the ground cleaners, if you will. So you can be for sure if your hemp product is being grown in a high pollution area or a contaminated soil area, it's going to be in the product, and that product's going in your body, and that could be a little scary. So, given that we talked about drug interactions, I want you to know that CBD is very safe, but there are potentials for drug interactions. And I think it's very important that you're aware of this because a lot of people are taking medications in this country that are on the next slide. The fancy words that are what to watch out for is anything that's metabolized by the cytochrome P450 enzymes, CYP3A4 and CYP2C19. But these enzymes basically are in your liver and they're working away to get rid of the stuff that your body can't eliminate. And when they're not working well, then you have situations where different blood levels increase for different products. And that's where we could have some risks. So let's look at the drugs that could interact with CBD. There's a lot of them, and these are some broad categories, and I didn't want to name any specific drugs, but I'm going to give you some examples here. So, a lot of different steroids or non-steroidal anti-inflammatory drugs. Think of Motrin, ibuprofen, Aleve, naproxen. Those medications are all metabolized by this same enzyme system, so we have to be concerned about that. Statins. If you have any type of heart condition or diabetes, you're probably taking a statin drug to help with cholesterol and lower inflammation. Interestingly enough, even my provider has told me that the reason that they want a lot of patients on statins, even if you don't have high cholesterol, is because it has an immune inflammation modulation effect. So again, mechanism of LDN, mechanism of CBD, we're looking at that inflammation underlying cause. So I think that's important. There's some blood pressure medications like calcium channel blockers. There's antibiotics. There's antidepressants. PPIs, proton pump inhibitors. I'm sure you've all seen advertisements for the little purple pill. Prilosec and Nexium, omeprazoles. So I'm not saying that you cannot take CBD if you are taking these prescription medications. What I'm suggesting is that you talk to the pharmacist and you find out what dose you're taking of these prescription medications, what your overall general health is, and we can work with you and your provider to find a solution to meet your need. We may need to help you modify some dosing. We may need to modify dosage form. So there's ways to look at this, but all these things matter in your health and safety. Side effects and dosing. Let's talk about dosing first because there are many different dosage forms for CBD. There are oral and topical forms. There are liquids and capsules. So liquids are tinctures. They are an extract that you generally put using a dropper under your tongue, and it's absorbed that way, bypassing the GI tract, so getting in your system faster. Capsules you'd swallow like a normal capsule. There's lotions and ointments. Lotions and ointments are going to have different levels of penetration and duration of action. And there's some other ones which I'd be remiss not to talk about, but I'm not real psyched up about. There's vape cartridges, which I can't get on board with given vaping risks as the data continues to come out on that. So that's something that is out there, but I would be concerned about using that. So, different types of duration of action. Interestingly enough, with a different delivery mechanism, you have a different duration of action. So, tinctures are the most flexible dosage form. Generally, on a dropper, you can dose anywhere from a couple drops to a full dropper full, and that gives you a lot of flexibility in experimenting with your dose. Generally, it takes about 15 minutes for onset of action, and it can last up to 4 to 6 hours, depending on your dose. Capsules usually are a 30 to 45 minute onset once swallowing, and they can last longer, 6 to 8 hours. They are the least flexible method of dosing because they generally come in 3 or 4 dosage forms, strengths-wise. 5 milligram, 25 milligram, 10 milligram, that kind of thing. Lotions usually start to work in 15 to 30 minutes and can last for 1 to 2 hours. They don't penetrate the skin as deep. They'd be more like on the surface. So think like a hand lotion. Your hand lotion's good for dry skin and things like that. Ointment can have an onset of 15 to 30 minutes and usually last 1 to 3 hours, and it can be very flexible for using in combination with an oral form. So keep in mind, let's say you have arthritis, and maybe on this strange sunny rainy day we're having today, maybe when it rains your arthritis acts up. Maybe you normally take a capsule once a day, but when you have rainy days, it flares up. You could use ointment with that capsule maybe once or twice a day for that extra support to get you through the day to help with that pain and inflammation. So that's something that can be very flexible for you. All right, we're coming in here. Side effects. Interestingly, from the Brightfield study to WebMD to a number of authorities, CBD is very safe. This stat alone is pretty interesting. Higher doses of 1,200 to 1,500 milligrams a day have been taken by mouth safely up for up to 4 weeks without any issues. So that to me shows that the side effect profile is really good. Now, I'm going to assume that's a healthy person not taking any of the medications in the previous slide that are metabolized by cytochrome P450, and they don't have any compromised liver function. But keep in mind that there are prescription items that have CBD in them. One is called Epidiolex, and it's approved to be taken 10 to 20 milligrams per kilogram a day. It's generally it can be used in kids as young as 2 years old for seizures and epilepsy. So anytime you're using a medication that's been approved by the FDA in children that are 2 years of age or older, the safety profile is very high. Keep in mind, you could have some issues with dry mouth, low blood pressure, lightheadedness, drowsiness, depending on the dose you take. We talked about liver concerns. This WebMD article, I threw it in here to be transparent. It says there isn't enough reliable information to know if cannabidiol is safe or what the side effects might be. In my professional opinion, based on my experience, I think topically it's safe. I've seen patients that have gotten relief very effectively for everything from nerve pain to arthritis to different things of that nature. So I think that's the conservative answer, but I think given the data up above, if you can ingest 1,500 milligrams a day for 4 weeks without any issues, I think that demonstrates the safety profile pretty well. I will say pregnancy and breastfeeding are a concern. I'm not going to recommend that anyone pregnant or breastfeeding use it. I do have patients that have come in and used it on their children. Generally, they'll use like a topical product, like an ointment for an ache or pain, like on a sprained ankle or something like that. But again, Epidiolex is an FDA-approved medication used orally for epilepsy. So that could be something that is a consideration, but just do it with professional guidance and good judgment. I wanted to throw a couple things in here on coronavirus, and I wanted to do it because I made some allusions earlier in the program to things, and I'm not sure how many of you remember from the very beginning, and I had to go back last night, and with the help of our researcher, David, I pulled some info out here for you. Coronaviruses, there's about 10 of them that float around the world and cause... or there's 4 of them, that float around the world and cause the majority of our common cold, believe it or not. So I know this one is really kind of throwing us for a loop, but we first dealt with SARS back in 2002, and this one came from China in this Asian palm civet animal. It's interesting how these particular conditions, they haven't gotten a lot of attention until they make their jump into humans. But this SARS, you may remember, caused a worldwide concern back when it came out in 2002. And it was this particular animal was the causative agent. And one of the interesting things is how these things somehow jump from animals to humans. And they think about it based on the type of animal markets where they sell food in China. It might be one of the reasons. And I'll show you a picture here later of Wuhan, which is kind of unnerving. But this is kind of like between this animal and it's kind of like a raccoon or a dog type animal. They were thought to be the reservoir. And basically, this was a situation where 20 or 30% of the people that got infected died. and or 20 or 30% of the people that got infected, needed ventilation, like you're hearing about today with COVID-19. And 10% of those patients died. They were able to control this particular situation pretty well. And it was a situation where there were about 8,000 people that were infected and 774 died worldwide. Interestingly, back then in 2002, this particular pandemic cost our global economy an estimated $30 to $100 billion. And who knows what this one's going to cost us. In 2012, we had MERS, and believe it or not, the vehicle that it came from was a camel, of all things. I did not know that until we dug into this. It had about almost 2,500 cases worldwide and almost 900 deaths. And the most of it was isolated in Saudi Arabia. So that was pretty interesting with regard to that. So now you all know we're dealing with this COVID-19 that came from this Wuhan market. And this is a picture of some of the animals and the condition of what the market looks like. It doesn't look like the most sanitary of places. And it's one of those things where, different parts of the world have different delicacies. And I guess, it is what it is. But they believe that the COVID-19, the host was a bat. And it's one of those things that we're struggling with containing using all of our different tools. And it's something that I think it's important that, as healthcare providers, why we're scared and what we're trying to do to protect ourselves from it. I'm sure you've all seen I hate to say pretty image of the microscopic version, but those little spikes on this particular virus make it very easy to attach to ourselves and very difficult to treat. And it's one of these things that I think as we learn more, I'm hoping that we're able to try to solve our problems with both our healthcare system and the capacity. I mentioned earlier in the program about inflammasomes. And, I think it's something we're all going to hear more about as we go on. But I think it's important to realize that as we deal with this underlying inflammation and this cytokine cascade of what gets released in the immune system, one of the ways that LDN may really overlap with treating in COVID-19 is that it actually can have an effect on those interleukin-6 reactions. And there's no data to suggest LDN can be beneficial in COVID-19, but it's one of those things that when you start to look at mechanisms of actions of what they're using to treat COVID-19 right now, they're using hydroxychloroquine. You've heard about that in the news, I'm sure. They're looking at azithromycin, and they're looking at a number of different interleukin-6 inhibitors, which are fancy names for HIV medications. And those basically help reduce that inflammatory cascade, much like LDN possibly could. So LDN may become a modality for COVID-19 at some point. There's not enough data to support it yet, but it's interesting to put your mind work into it. And I'm hoping we have a Dr. Bahari type individual who's able to look at this and see if it could be a benefit for the population of the world. This is the last slide I got that I'm going to show you with respect to our program today. And as I was looking at this last night, I know some of us question the accuracy of the data that's coming out of China with how quickly they reported the situation. But if you look, that December 31 was allegedly the first case that was reported. And by January 8th, they had shut a large portion of China down because of the spread. It's fascinating for me to learn that the first person in the USA that brought COVID-19 here, I believe it was January 21st. And as of last night, when I was looking at this program, even though we still don't have enough tests to test everybody, we've got almost 500,000 patients that are infected in this country. That is a crazy fast infection and duplication rate. So, if nothing else, I want to stress to you what you've been hearing already. Stay home if you can, go out minimally. When you go out, wear a mask, wear gloves, take your hand sanitizer, touch only what you have to. Don't touch your face. At the pharmacies, we've been working really hard to keep our staff safe and our patients safe. Where we're operating right now in the pharmacy only from a closed door operation. So what that means is we're operating with drive-up window. we're operating with curbside service, we're operating with home delivery. All of these things are designed to help minimize your interaction with both the inside of our stores, just so that it helps us be more efficient in our cleaning. It also helps minimize what you come into contact with. So we're trying to make sure that we do everything we can on our side to keep you safe and keep ourselves safe and try to keep some mental peace of mind. I know we all have some concerns and anxieties about it. I hope that if you have questions about anything, we can be a resource for you at the Medicine Center. I really appreciate you tuning in today. I've seen a number of people pop up here with questions. And I appreciate if you want to ask any other questions, I'm happy to address them online or off. You can go to this page and put in your email address. I'll be honest, I don't have the packet ready yet. I've got it all in these binders, which are readily available, but I'm going to put it together and wrap it up in a PDF for you, or put it on our website in a place that, since you joined us today, you can access, because it's literally hundreds of pages, or it could be. But I want to give you the information so you can empower yourself and your physician to learn more. If you've tried LDN, I see a couple people that have commented and you haven't had luck so far. I want to encourage you not to give up. Much like LDN, if you try it for a period of time, I would say you give it a good 3 or 4 weeks before you ask questions. Sometimes it just takes a little bit of time. And you know what? If you take it for a month or you take it for 2 months and you don't have any effect, we may need to look at changing your dose. You may not have the right dose. For example, we've had patients on fibromyalgia that might get started at 4.5 milligrams, but actually their target dose is 3. So if you started that high, it doesn't always mean it's going to be better. A lot of physicians have faith in the studies that came out in 2007 and in 2010, and they work for 40, 50% of the people. But if you failed on LDN, there's one of a couple possible reasons. And it could be because you got started on the wrong dose, or maybe the titration therapy wasn't the right one. And we just need to look at that. There's no harm in trying. We can help you talk to the doctor. We can help work with you. No worries. It's something that we do all the time. So that's that. The other thing I wanted to do, I had the privilege of being interviewed by Linda Elsegood from the LDN Research Trust. She was the author of the LDN book that I showed earlier in the program. I'm going to be on her podcast that's released on April 15th. They have a Facebook page that's called the LDN Research Trust, and there's a link on our website at medshoprx.com under / low-dose naltrexone, which is the page that it'll take you to after you put in your email on this FB Live form. But you can go to the LDN Research Trust, and there is a wealth of knowledge there. Very high quality information from providers all over the world that really have a great handle on helping patients meet needs. So thank you so very much for joining me today. I hope it was valuable. I hope it came across okay. It's my first time on Facebook Live, if you can believe it. But I appreciate all your attention and time, and really enjoyed being here sharing with you today. So have a great day and stay safe.